Right. So let's have a look at this one. So navicular, you know what? I usually, when I do these X-rays, I will go for the heads. Okay, so you look at the metatarsal heads, just make sure there's no avascular necrosis, and then I look at the shafts of the metatarsals as well to make sure there's no evidence of any stress fractures. And sometimes they can be so subtle. You really got to zoom in and see whether there's any sort of fluffiness anywhere like that, or any sort of discrepancy anywhere. In this one, I don't think there is any sort of stress fracture whatsoever. And then the next thing you want to do is have a look at these toes, right? The right at the end, the terminal phalanges, because so many times these things are missed. So what I've done over the years is try and figure out like what are the things that are generally missed and go for those things first and then go for the more obvious stuff, right? So you'd really look at these and make sure you draw around the nail bed, right? Just to make sure that, yeah, I know what the nail is. I know what the nail is. Those aren't going to be fractures. That's nail. That's nail. That's nail, right? And just have a look that there's no fractures, there's no crush fractures or anything like that. Someone's already picked it up, which is great. But yeah, you can see that there is definitely a fracture located in the neck of the third metatarsal, right? You can see that kind of irregularity there, slightly displaced as well. Now, what I'd always say as well, like I'd never ever stop. Once you've seen the X-ray, you just still got to keep looking. You just got to make sure because people don't go away with like just one fracture most of the time, right? You just got to look to see whether there's any other injuries, right? You got to make sure that the second metatarsal base aligns with that sort of intercuneiform space. Make sure there's no potential Lisfranc injury. You also want to make sure that there's no fracture of the navicular bone. I've seen so many of those over the years. Cuboid as well, very common. Interestingly, I've noticed that we get a lot of CT scans because in truth, the foot X-ray looks normal. And yet again, this tiny little fracture, like right at the end of the right around here. Here's someone saying they saw a hairline. Okay, I'm going to have a look for you. So there's someone saying maybe a fourth hairline. So one, two, three, four. And we're going to zoom in a bit. So you know what? These days I tend to not go for hairlines. Like I remember when I was, yeah, I just don't generally go for it unless it's like unless a fracture is blindingly obvious. I don't really go for it. So you're saying fourth, I assume neck. Okay, so fourth neck. So we're going to zoom in a bit. Okay, and we've got to try and draw around. So first of all, draw around, make sure we can really identify. Yeah, I don't think I can 100% see it, but you're right as well. Like it may show up later. You may be doing a follow-up X-ray and you may see some callus formation. Oh, okay, I didn't see that. And you're again right. Like sometimes we'd get a normal X-ray and they come in and they'd have like a really small fracture. And I'll show you where generally this is where I always look whenever they get a CT scan. I always look in this area over here, the distal sort of the distal calcaneum and the cuboid are very common places, and around here as well, like the kind of more medial aspect, or I guess that'd be the lateral aspect, the more lateral aspect of the navicular. This area here seems to get really tiny, subtle fractures as well. So very important to look. And obviously, you know, the less likely places to have a look is that sort of lateral malleolus, the medial malleolus. Look at the tarsal dome as well, because yeah, sometimes people have got a more significant injury than they've alluded to, and they've got more fractures than you'd otherwise initially anticipated. Right, so let's go to the next case.